The symptoms began with shortness of breath and then some chest pain that didn't seem to go any place. It just was right where the heart is. And it started getting progressively worse. I would go out to the garden and check out my flowers, and that's when I really started getting chest pain, couldn't breathe.
When we see patients like Rosalind, we look at a few things. One is they need to have a diagnosis of aortic stenosis, which is the thickening or the narrowing of the valve, or known as sticky valve. In addition to that, we look at the symptoms, and the one that Rosalind mentioned, like shortness of breath, chest pain, dizziness, lightheadedness, and a very unrecognized symptom is feeling fatigued, tired. Over the past few months or years, progressively getting worse. So when I met Rosalind, she was referred to me by Dr. Hagao. She did have all those symptoms, plus confirmation that she has diagnosis of aortic stenosis done by the echocardiogram. In addition, I remember Rosalind was and used to be very active. She had a very active lifestyle. She was very involved in her community. She had a great social life. She had friends and family that she visited, and she wanted to continue doing that. So that's when we intervened at that time, and I thought she would be a great candidate in doing this procedure, but not only make her continue doing that, but actually even do more. TAVR is most commonly known as, but it stands for transaortic valvular replacement. So it is a minimally invasive surgery or a procedure where we implant a bioprosthetic valve, which may be made up of a cow tissue or a pig tissue, and we go in and deploy it, and right away it takes over the function of the diseased valve and starts functioning. In doing so, in opening up that narrowing with a new valve, it restores blood flow throughout the body, and our patients feel difference most of the time right away.
Oh, what a difference. What a difference the post-surgery was. I was able to walk without having the chest pain that just didn't seem to go away. The elimination of atrial fib was gone. And I was out in the garden 2 days later digging my plants out and replacing them and thinking that didn't belong there, but it belonged here. So my creative juices were really flowing. I feel great. I feel like I've had a second lease on life.
It's undescribable. No, and this is why we do what we do, and this is, I think, one of the most gratifying and satisfying feelings I can have as a physician.